everyone, I'm Dr. Chris Perron here at Perron Chiropractic in Reston, Virginia, just a few minutes outside of Washington, D.C. And in this episode of our learning series, I'm going to discuss with you TMJ. All right, let's figure out what TMJ is, right? So T stands for temple bone, which is a bone on the side of your head about like my hand right here. M stands for mandible, so your lower teeth, right? So the part that moves when you chew and you talk. And then J, joint. So that's TMJ, temple, mandible, joint. Well, it's always a relationship issue. If the joint is not lined up, mandible to temple, either side, mandible's a horseshoe, so it hooks on to either side of your face, then it's going to cause some serious issues. There are the nerves that go to your face come through your jaw joint. And so they go on three main branches. It's called your trigeminal nerve. So things like Bell's palsy, trigeminal neuralgia, all these things are actually triggered typically by a TMJ issue. A TMJ issue that we deal with and get fantastic results with on a daily basis. We've had people here with Bell's palsy, trigeminal neuralgia, migraines. Migraines are a big one. The big difference we found with a migraine as far as headaches go versus a headache, as brutal as that might be, is the jaw being a factor. The jaw carries so much neurology, it just, If you've had it or you're watching this video because you have it, you know what I'm talking about. Not good. But there's tons of hope. The technique we use here, activator methods, is ideally suited for evaluating, first of all, to figure out if your jaw is out of place. If it is, what direction? Up, down, left, right, forward, backward, left side, right side, all of those things. Are your collarbones out of place as well? This is a pretty common one. They'll shift here because this big muscle attaches from A to B. And if either end or both ends of that equation are off, there's typically going to be a pretty big impact on the TMJ. Locked jaw, your typical stuff, crunch, click, you move, and you can tell it's not flowing and moving correctly. All of those things, terrible. We actually even have people come in where they feel like they have a tooth issue, and they're like, can you adjust it first to make sure my jaw is correct? Because the nerves that go to your teeth actually come through that joint. So if you have a lot of dental issues, you really want your jaw to be checked and evaluated, and I mean this way. Dentists, love them. Have a lot of neighbors that are dentists that I love. Very friendly and very nice. They actually refer patients here to check the TMJ because they know that our analysis is so precise. And we obviously get great results, so patients report back, yay, it worked. And so, yay, we're all looking for answers, right? But they have to get in there and do their thing for your teeth. Well, every once in a while, nobody did anything wrong, but if you got your mouth wide open and you don't open wide enough and so on, it's not uncommon. Now imagine you're getting some like real dental work done or orthodontics. All those things are strain on the jaw. Now they can be for a good cause by all means, but that doesn't mean that there might not be a little something to polish off. And it's very simple, especially if it's caused by that, and especially if it's caused by that recently. Typically 1 or 2 visits and the jaw is fine. Longer term stuff, clearly, yes, it usually takes longer. But TMJ, very, very, very treatable in 99% of cases. Also, our evaluation process is so black and white to where we can tell you if it's not your TMJ, because you may be having those same symptoms that go with it. But if we can check this box off to go, it's not this, and unfortunately, if you still have the symptoms, at least it brings you closer and we can help point you and refer you to the specialist that deals with the other possibilities that go with the same sort of symptoms. So in the end, we're just trying to help find answers for you. TMJ, Activator Methods Chiropractic, here at Perron Chiropractic, is by far the fastest, easiest, and simplest approach. That's why we suggest it being first. If this is your issue, the one that we deal with, there isn't a different treatment that's going to deal with it the same, and typically not as well. Cracking jaws and surgeries and so on are not so enticing, and in our experience, we've actually found that it doesn't really do a good job most of the time either. But everybody's different. One way to find out, come on in and get things checked out. We could tell in minutes whether you fit the mold for somebody who could benefit from what we do to help you with TMJ issues. And if you found this video helpful, please hit the like button. If you want to find out about other illnesses and issues that we deal with, hit the subscribe button. And again, I'm Dr. Chris Perron, and I look forward to meeting you.